Sweet. Okay. Oh, one more. All right. Okay, so I think we'll get started. I'm Jessica. I am the president of the Alberta Horse Trials Association, and I'm also a communications chair. And we have been putting these online education sessions on for a couple of years now. And Sarah has graciously been our speaker several times, and she's always been amazing, which is why we have her back. And I'd also like to thank Kathleen Ziegler, who is also on the Alberta Horse Trials Association board. She is our high performance chair, and she is the one who has organized these sessions for us. She can't be here with us today, but she does a lot of work behind the scenes, and we are very thankful for her. And so I'd like to introduce Dr. Sarah Pedersen. She is going to introduce herself and then get into this what is going to be a very interesting talk tonight. And if anybody has any questions during the presentation, if you want to put them in the chat, we'll get them all answered for you. And also, if anybody here who is joining, like I know we usually have people from Alberta, BC, and Saskatchewan. If you're not from one of those three spots and you're from somewhere else, we would love if you would write where you're from in the chat, just so we're aware of where you come from, because we're tending to reach more people with our educational sessions, and we think it's very, very cool.
Ooh, Manitoba.
Oh, nice. Perfect. Okay, all right, so I'll stop sharing my screen, and Sarah, you can go ahead and share yours, and you can take it away.
Sure, let's see. Hopefully this behaves itself. I don't trust Zoom sometimes. Okay, does that look like a presentation?
Yep, that looks wonderful.
Okay, great. All right. Good evening, everybody. So when I was chatting with Kathleen to put this together, we always try and come up with a really relevant talk. So we've done one on kind of the aging competition horse. We've done one on fitness. And so I was chatting with her, and we decided that what might be one of the best things that we can do is just talk to people about evaluating performance and how you can get your best performance from your horse, whatever that level is. So for those of you that don't know me, this is, I believe, 1997, back in the UK. So I was born in the UK. Obviously, the accent's a dead giveaway. I rode horses growing up. I was deeply involved in the pony club, came to Canada, became a veterinarian, and I have a specialist interest in kind of rehab and functional neurology and kind of performance horse medicine as well. And so that's a little bit about who I am. So, why is this? Oh, there we go. When we talk about performance horses, we need to think about fitness, but traditionally we think about fitness as the condition of being fit and healthy. So the horse's cardiovascular fitness, heart rate. We're all pretty familiar in eventing with kind of heart rates, respiratory rates, how quickly the horse's heart rate should come down, all of those things. But really fitness, we need to think about being suitable for a particular role or task. And performance is the ability to carry out an action, a task, or a function. So the reason that I come back to this is because for those of you that don't know, this is my horse Max. He always features in the presentations because we're very amateur, and oh goodness, I'm going to embarrass myself now. It is now the 0.85 or the 85 level, what was entry level. And so we're not very, super competitive. He does a good approximation of a rabid giraffe in dressage, but he's perfect for me because he doesn't mind if he doesn't get ridden. He stands still at the fence and lets me climb on him bareback. So he is fit for the purpose that I use him for. And that's a lot of what we need to consider with performance as well. So again, when we talk about athletic performance, I think a lot of us are familiar with, we talk about, does a horse have good conformation? Does he have a good aerobic capacity? What is his skeletal muscle? What's his heart size like? When we look at performance for race horses, we talk about gas exchange or oxygen. That's great. And those are all definitely appropriate and applicable markers for fitness. But the other thing that we have to consider is the athlete's willingness. So for me, I definitely want a willing partner, especially if I'm going cross country. I really don't want a horse that, doesn't want to do the job, right? Unfortunately, Max's job is to dig me out of a little bit of trouble sometimes. And so I want a willing partner. I want a partner that's trainable. And then we also have to take into consideration the environment, the rider and trainer availability. I definitely don't get to ride as much as I would like just because I'm busy at my job. And then also, things like attack and those types of things. And that all falls into performance. And so when I was putting this together, I wanted to talk about kind of, first of all, the regular performance evaluations. So those of you that know me know that I like to talk about this paper a lot and talk about, the best defense is a strong offense. So this was a paper that looked at gait abnormalities in the ridden horse. And essentially what came out was over 60% of those horses that were being ridden, doing the job, competing, were lame. And so for me, that's a pretty large number, that almost 2/3 of our horses that we're riding and they're doing the job are lame. I kind of wanted to take a minute here and talk about my sort of top 10 tips for lameness. And this is not an exhaustive list, but this is kind of, how do we know if our horse might be lame? So most people are really familiar with the forelimb lameness head bob, right? Most people have seen that. And the trick to remembering, and it happens to me quite often, is remember that when the lame leg hits the ground, the horse's leg will or the horse's head will raise up because he wants to take the weight off that leg. And then when the good leg hits the ground, it looks like the head nod is down. So you always remember down on the sound. And it's sometimes a little bit counterintuitive for people. So if you see a head nod, there's a chance that you've got a lameness. I think most of us instinctively know to check for heat and a pulse. So inflammation tends to bring blood to the area. So if the horse's foot is hot or the leg is hot, I think most of us know to look for that. A horse with arthritic wear and tear, which is common in our older competition horses, will often get better as they go, or they'll warm out of it. Okay, that's often kind of, the lameness will get a little less obvious in the first few minutes, and usually that horse will be worse on hard ground. A horse with soft tissue damage usually gets worse as the ride goes on, and they're worse in soft ground. Again, not every horse reads the book, but these are kind of my top tips to be like, oh, do you need to, do something a little more intervention is required, or is it just that he's had a stiff day? Horses with bilateral, so both front feet that are sore, those can be really tricky. And that can often happen, for example, if we have hard ground across country and we've been riding them on hard ground, they get sore front feet, kind of bruised front feet. And then that way you won't see a head nod, but what you'll see is that choppy stride. And that's because both front feet could be sore. If I always tell clients as well, if you're struggling, if you don't know if your horse is lame or not, take a video and put it on slow-mo on your phone. That often really helps people. Hind limb lameness is more difficult to detect. Generally speaking, you'll see more vertical movement in the hip, but that can be a tough one. I think most of us instinctively know putting a horse on the lunge line can often exacerbate a lameness one way or the other. And then if a horse looks lame on one leg, but the pulse or the heat is stronger in the other leg, usually because the good leg has been taking the weight. And then the other thing to remember is a horse can look completely sound without a rider, and then you put a rider on and they look really lame. And so that's when we start to look at things like back pain or saddle fit. So really, this isn't about me teaching you guys to spot lamenesses, but that's just kind of some things that we can look for. Getting into a little more of what we're going to cover tonight, an often overlooked clue that there can be a problem is your horse has a really bad direction. So just like people, horses tend to be left-handed and or right-handed. The example I have here, a young colt that's just been broke, will likely be resistant to taking like one canter lead over the other. Usually we don't worry about that, but a well-trained, seasoned event horse that suddenly doesn't want to pick up a lead, that's when we need to start looking at some intervention. So I kind of gave you my like top 10 tips, but this is kind of number 11 and one that's often overlooked. And my rule of thumb is sudden behavior changes are due to pain until proven otherwise. You know, it's our job to discover the source of that pain. So again, if you've been to one of my talks before, I really like, and usually what happens is Jessica will send out the copies of these articles as well for you to read afterwards. But this one, I think it's pretty well accepted now. Most people sort of know it pretty well. Is the 24 behaviors of a ridden horse in pain. So I have it up here on the slide. You can find this paper. We can get you a copy of it. It's not a problem. And I feel like most of us that are horsemen kind of instinctively know this stuff. You know, ears rotated back behind the vertical. That's pretty, you know, pretty common knowledge. Tail swishing in large movements. We know about that. You know, hind limbs don't follow the tracks of the forelimbs and go left or right. There's lots of things. And so I really like this because I think it's something that we can come back to and your trainer can come back to. Or if you don't work with a trainer regularly, you can video your horse and then look at the video after the ride. And, you know, just make sure that nothing is changing or nothing all of a sudden has reared its ugly head. So that definitely is something that I think is really helpful in terms of kind of lameness. But like I say, the purpose of tonight, I didn't just want it to be about, you know, is my horse lame? Because that would have been a different talk. So 60% of performance horses have some level of lameness. We know that. And hopefully, you know, we can look at behaviors when ridden, we can look at the horse's stride, we can deal with that. What I want to try and kind of challenge you tonight is, can we get to it before it becomes a problem? So I'd encourage you to look at this list of behaviors. And if you're seeing a few that have started cropping up in your rides, that's something to take a look at. So this is kind of where we're going with this. So evaluating performance beyond, is my horse lame? Okay. Performance is subjective, like I mentioned before. Every horse and rider has a genetic limitation. That's why we're not all Olympic sprinters. I'm certainly not built to be an Olympic sprinter. But we can help every horse be, you know, this is a little cheesy, but we can help them be their best self, whatever that may be, whether it's like my horse that's you know, an entry level, or whether it's our prelim horses or whatever, we can do our best for them. So I get this all the time in my practice. So he's not lame, doc, he's just a bit off, or he's just a bit stiff, or that's just him. Again, like I said before, the goal of this evening is not to teach you how to diagnose a lameness, but generally speaking, musculoskeletal problems are the #1 cause of poor performance, because poor performance or changes in behavior are due to pain until proven otherwise. So that's fine. Okay, we get that a lot of horses are struggling with that. But what about if there's a neurologic component or a mechanical lameness or muscle stiffness? Okay, all of us have, you know, overdone it, and you're a little stiff for a day or two. Doesn't mean that you have arthritis, doesn't mean that you have an ongoing problem. But we want to make sure that we differentiate between a lameness, a problem, or a horse that's just maybe been overworked in his program that day. So Another thing that we need to ascertain is when we're looking at gait, is the horse lame or is the horse neurologic? Because those are two very different ends of the spectrum. And the classic saying is a lame horse is regularly irregular, and an ataxic horse, which would be a neurologic horse, is irregularly irregular. So let's just unpack that a little bit. So I'm hoping that most of you know that our 4-beat paces are walk and gallop, and our 2-beat paces are trot and pace, if that's appropriate to your horse. And a 3-beat is our canter or lope. But then remember, we also have that disunited or rotary canter. So when we talk about irregularly irregular or regularly irregular, if you think about a trot, because we usually examine a horse at a trot, a horse that has a lame left front, every step he takes on that left front, his head will come up. Ouch, ouch, ouch. So the stride and the gait is irregular, but the recurrence of that is regular. It's every time that left front hits the ground, we see an off step. So that would be a lameness. That would be regularly irregular. In a neurologic horse or a horse that has some neurologic challenges, it's random. It's just, it happens when it happens. Sometimes the step is wide. Sometimes the step is underneath the body. Sometimes the foot will cross midline, and there's no rhyme or reason or pattern to it. So that's, to me, you know, if your horse is a little sore on his left front, okay, no problem. Maybe you give him some bute, maybe you call your trainer, maybe you call your veterinarian. If a horse has got that irregular neurologic gait that has no rhyme or reason to it, to me, until that horse has been checked out and you know why, that's not, that's a veterinary problem. And so, again, not to bore you with all of the terminology, but the changes that we see are ataxia, weakness, spasticity, and dysmetria. Ataxia is basically poor coordination. Weakness is kind of knuckling or stumbling or dragging of the limb. And then spasticity is kind of a stiff movement of the limb with little flexion of the joints. And then dysmetria is an increased flexion of the limb. So I always tell people to think about like a horse that's trotting through water will lift its legs really high. A dysmetric horse will look like that, but not in water, just regular ground. And so, again, my goal is not to turn you all into veterinarians tonight, but if you see some of these things, even if they're mild, you need to pay attention to them. And really, the importance of fitness in injury prevention, the major problem in training horses for athletic activities is keeping them injury-free. I don't think that's a news flash for anybody here. We know that. And by far the most common reason for a horse to retire is musculoskeletal injury. Again, there are many factors that contribute to that. There's conformation, there's the schedule of training, there's this training surface, there's age and stage, there's all kinds of factors to that. So my goal tonight is we've talked, a little bit about lameness, and I understand that that is probably the major thing that we need to keep in mind for our performance horses. But let's kind of unpack and dig a little deeper into some of the other things that we can do. Anybody that has heard me talk before knows how I feel about cooling after fast work and my hatred of ice boots. So during galloping, the temperature in the core of a large tendon can be up to 44 degrees, which is the same as the muscle. The heat within the tendon can damage and kill tendon cells, and that can lead to inflammation. Inflammation can lead to damage and weakness in the tendons, and over time, that can lead to a failure, a rupture, or a tear. Absolutely, you should be icing your horse after fast work, but these ice boots, like the ones I have pictured, they actually don't do anything because little air pockets form in those wraps, and it cools a little bit for the skin, but it actually doesn't cool the tendon. You need to have a 4-degree slurry of ice and water. And so that's definitely something that we can do that can protect our horses in the long term. And it's always controversial when I say that, because people always say, oh, well, I've used those for years and I've never had a problem. That's great. But the science tells us that these are really no good. We really need ice and water. Now, having said that, not talking about a game ready system. That's different, because they have the compression and they circulate ice water through. So, by all means, stand your horse in a bucket of ice water, go down to the river and have your horse have the cool water go past. But we need that mix of water and ice. These things just create little pockets of air, and that's not a good cooling mechanism. And everybody knows that's kind of a pet topic of mine. Massage. So plus or minus chiropractic work, plus or minus all of those things. So I touched on it a little bit earlier. So a young horse that's coming into a work program, just like us, if we start at a program in the gym, or even this is, Max, he's a bit fluffy after the winter and he's coming back into his training program. If I push him a little bit too hard, he's going to get muscle sore. That's just the facts of, exercise and increasing your workload. So massage is absolutely a great idea. We know that it reduces pain and muscle soreness. We know that it improves circulation, which means that it also helps us to move waste products away from the muscle, namely lactic acid, along others. We know that it actually improves immune function because you're moving that lymphatic system. It's huge in injury prevention. And on that note is also kind of stretching your horse. And so I see a lot of people in my practice that say, oh, look, doc, he's great at doing his cookie stretches. And they take a cookie and they reef it right round to the horse's hip, and the horse kind of pretzels himself around and snatches the cookie. That's not improving range of motion, and that's not helping. And so talk to your massage therapist, talk to your veterinarian or your chiropractor, whoever does that work, and get a stretching program, A, that is specific for your horse, and B, that is appropriate for increasing range of motion. If we increase range of motion, we decrease the chance of injury. So that's another kind of tip and trick that we can, assess performance. And if you're doing the certain range of stretching and all of a sudden your horse, he can't make that one stretch or that one exercise to the left, that's something to be looking for. So you're like, okay, what happened? Is he just stiff today? Or is that actually a problem that I need to pay attention to? And so I'm really big on giving my clients homework and giving them stretches to do. And it's different for every horse because it depends on what we're trying to work on for every horse. All right. So as I said, I think we've kind of done that one to death. So, okay, a horse is not lame or asymmetric or stiff or all of those other things. What else can we do to help our horse? Okay, a nod to dentistry. This horse has what we call a shear mouth. You can see that the incisors are not aligned. The bottom tooth and the top tooth don't line up. That's really important. The TMJ, or the temporomandibular joint, actually functions across the whole body. The fascial planes run across the whole body. And so if we've got an undershot or an overshot jaw, or just if the teeth aren't floated correctly, that's going to cause a whole bunch of problems. So definitely be checking on your horse's teeth. For sure, younger horses, I usually recommend up to about 6 or 7, or at least checked twice a year. And then the flip side of that is horses that are a little older, or our senior horses, should at least be checked twice a year. Depends on the problem that you have going on, or if it's just a routine float, but definitely routine dental care is really important. So I tried, hopefully you can see this okay. On the right is a fairly standard mouth. The horse has a full set of teeth. And on the left here, this is a very senior horse. So you can see that there's not much tooth left. In fact, they're completely worn down on this side. And so that horse is going to require a little, different dental care and dental schedule and feeding schedule to the horse on the right, but it's really important that we look. Let's see. And then we have, this is what we term a wave mouth. So hopefully you can see there that we've got a big old long tooth in the front and then a really short worn out one. You can see here there's lots of ulceration in this mouth on this horse's cheek. And then you can see hopefully on this picture the big old tooth at the bottom here, and then it's worn down and then it stands up. That horse's jaw and that horse's temporomandibular joint is not going to function correctly, which is really less than ideal if we're wanting them to, you know, have a bit in the mouth, do their job. And the temporomandibular joint, there's lots of association with subtle hind end lamenesses with a dysfunction in the temporomandibular joint. So it's really important that you take care of that and make sure that that is functioning correctly in order to maintain your horse's performance. Okay, this is now my disclaimer. Nutrition is always a wildly hot button topic. Everybody's got an opinion and everybody thinks everybody else's opinion is incorrect. Again, my goal tonight is not to open a huge can of worms. It's a very complex topic, but what I want to open your eyes to is it's not a one size fits all. And just because a program or a supplement works for your friend's horse or your bandmate's horse, or it's what you've always done, it doesn't mean it's right for your horse. Along with that is supplements is an even bigger can of worms. Certain supplements we know do have some science behind them, but again, what's your goal and what is right for your horse? So nutrition is a huge part of the program, but you need to speak with somebody that's, you know, going to help you look at your program. It always surprises me the number of people that don't test their hay and don't know the protein level in their hay, and that's kind of the start to your nutrition program. There's lots of help out there. If you're willing to look for it. Some tried and true supplements that a lot of people know. So MSM, we know that helps with inflammation. Magnesium, we know is important in muscle recovery. Vitamin E is very important for nerve health. And then the omega-3, 6, 9 helps with inflammation. I could have done an entire topic on nutrition and nutrition supplements. It's a huge topic. And really all I wanted to do tonight is bring your attention to it is an important part of the program and it really can affect performance. Along with that is lumped in along with nutrition is also gastric ulcers, which always are a huge kind of concern and consideration in the performance horse. And that comes along with your management and your nutrition as well. And it comes back to behavior changes are due to pain until proven otherwise. Gastric ulcers are painful. And if your horse develops an ulcer, it's painful and it is going to have a behavior change. And so that's kind of what I want to discuss in that I'm not going to tell everybody you should feed this much hay and this much grain and this much this, because every horse is different. But know that it's a really important part of your performance evaluation for your horse. I would advise you just to be a little bit careful on supplements. There are some very reputable companies out there, and there are some not so reputable companies out there. And so do talk to the companies, look for one that does voluntary testing. I will say one I like to use is the Trisana company, which I think a lot of you know, Tanya. I've found her to be very helpful with nutrition and also very knowledgeable, and they actually stand behind their products, and it is actually what it says on the bag, which is not the case in a lot of them. But again, that's not the goal of this evening, other than I would encourage you to look at your horse's nutrition, because if your nutrition is off, then the performance isn't optimum. Parasite control. This is another interesting one that often gets overlooked. So I won't poll everybody, but you know, how many people deworm in the spring and in the fall? Because that's what we've always done. Actually, we're learning now that that's not the best way to keep our horses safe. There's a lot of resistance to the deworming medication. And so now the strategy has changed. in that we tend to look at fecal egg counts from horses and then strategize which horses need to be dewormed and with which product. There's quite a science behind it. And so the kind of old thinking of, wait till the first hard frost and then deworm is really going out of fashion, because we're getting, unfortunately, so much resistance to our anti-parasitic drugs. It kind of goes without saying, though, if your horse has worms or has parasites, that horse's nutrition isn't optimal and its performance can't be optimal. So we need to think about parasite control. Farrier work. Again, does your horse need shoes or not? What is the schedule of your horse? So a lot of horses actually really need to be shod every 5 weeks. And sometimes the farrier comes to the barn every 8 weeks. And so sometimes I'll get a call that the horse, oh geez, he seems a little off every time, we get close to the shoeing schedule. Yeah, you might need to shorten that schedule up. Speak with your farrier. Sometimes radiographs are really helpful. Most horses we can shoe without radiographs. The odd horse, the bony column is just doing something we really don't think it's doing inside there. So this particular x-ray, you can kind of see the banana angle here. And ideally, we want the angle of this hoof to match the angle of the pastern. And you can see in this particular horse, that's not what we've got. So we could help this horse by shortening up this toe, bringing this shoe back quite a lot. And we're going to make that horse an awful lot more comfortable. Some horses don't need this. Again, this is, a very personal kind of individual horse decision. I have lots of clients that I radiograph the horse's front feet every 6 months because we have to keep them on such a tight shoeing schedule. And this is a horse that I saw. So this was on the same day. And so hopefully you can appreciate that, it looks like there's a big twist through the bony column here. And that's because the horse had grown uneven foot. And it's not that the farrier had been doing anything wrong. You couldn't see that from the outside. But the horse was kind of a little bit intermittently off, intermittently lame, had started stopping, didn't want to jump, right? Pretty standard decrease in performance. And when we had a look, this was what was going on. This is the same horse, the same leg, it's the right front and the right front. After we trimmed the horse up and balanced it, and you can see the horse is standing square, and that horse never had another problem. But we're pretty aggressive on keeping on that horse's trim schedule. And so again, it's a conversation to have, and it's very hard when we see our horses every day to be critical. But do try and take note of, are they standing differently? Are they standing with one foot in front or behind? Are they pointing a toe? Often you can spot those things before your horse is actually lame, and we can stop it before it becomes a problem. We're hitting all the controversial topics tonight. So saddle fit. So you can see here, this is me bareback on Max, getting him fit because horses change shape. And him and I are both a little fluffy from the winter, and the saddle ain't going to work right now. Horses change shape, people change shape. It is often an overlooked area of performance. Schedule regular checkups with a professional, with your trainer. And I tend to say, if you have a new saddle, get it checked at 3 months and 6 months and a year. If it's a saddle you've had for a while, every 6 months or so, and work with a good fitter. Saddle fit, I think, is one of those real, again, it's a huge can of worms topic. And I'm not a saddle fitter. I'm a veterinarian, but not a saddle fitter. But I know enough to be like, this horse's back is really sore. We need to look at the saddle. And often very, very small changes in the horse's muscle or the horse's top line can cause a huge change in how that saddle fits. And again, that can be a piece of your performance. So, set an alarm in your phone every 3 months. Put the saddle on your horse without the blanket, without the pad. Just put the saddle on your horse's bare back and just take a look, see how it's fitting. Also examine your saddle. I had a really terrible case actually where the owner had ordered a brand new saddle, and it was very expensive, and it had taken a long time to come. And the horse's back got really sore, and I was called out to evaluate the horse because the horse had a sore back. And I said, okay, well, let's have a look at your saddle. She said, oh no, it's brand new, I just had it fitted. And I said, okay, well, let's take a look. And unfortunately, the panel had been manufactured incorrectly. And so the saddle, kind of the panels on the saddle were like this instead of being like this. And so the saddle company, of course, rectified that, but it's just, be critical and have a look at it is my point. Metabolic disease. So we've got equine metabolic syndrome and PPID or Cushing's, and sometimes we have all of them at once. I bring this up, this isn't necessarily applicable to every horse, but often when I do this talk, people are a little shocked. About 15 to 30% of horses over 15 years old are testing positive for Cushing's. And so 30% of horses over 15, that's almost a third. A lot of our event horses tend to be older horses and senior horses. Also, there seems to be a misconception out there that they can't show on Pergolide. They can, which is why I have the permitted medications there. They are actually allowed to show on that medication. The other thing is, if we can get that under control, if we can spot the early signs and do the blood work and do the testing, we can hopefully prevent anything else. And there is an associated there is an association with Cushing's and suspensory breakdowns. So ideally, if our horse starts to show signs, we can get that tested, we can get that horse taken care of, and we can hopefully get that under control before we start to see secondary changes throughout the suspensories. And like I say, I bring up the showing on percent because there seems to be a little bit of confusion about that, but you can show on that medication if your horse needs it, obviously. Okay, injectables again. All kinds of injectables out there. The two that are most common are Equine and Legend. Most people are familiar with them. They both have studies behind them. They're both effective. I find that some horses do better on one and some horses do better on another. There's a whole bunch of other ones. Again, this is something that I'm bringing up to say, if you want your horse to be at its peak performance, then it's absolutely something that is reasonable to do. They're both legal for competition. If you're going to use anything else, just make sure that you speak with, a trusted source, your veterinarian, your trainer, and just make sure that either you can show on it or that it's legal, or double check the route of administration. Sometimes people get confused and it goes, IV when it should go IM and those types of things. So just be really careful, using something that, your friend got you from the States or whatever. I'm not saying don't do it. I'm just saying be cautious and make sure that it's A, legit, and B, you understand the medication and how it's supposed to be used. I see a lot of people, the studies on Adequan, and again, I think a lot of your veterinarians will tell you this, but the studies on Adequan were actually the 7 vials over a 28-day period. So one injection every 4 days. And then that should, in theory, be good for 6 months or 12 months. I see a lot of people that give Adequan once weekly. It's not that there's anything wrong with that, but we don't know. We don't have the data and the information on that. And so, again, talk to somebody that is going to tell you how to use it appropriately. So kind of finishing up here, it's what is the goal? And that's probably the most important question to answer. Talk with your trainer, talk to them about your goals, because everybody's goal is different. My goal is that I would just like a happy, willing partner, and I want to get out and have fun. Other people are trying to make, junior teams, or they're trying to make the finals, or they're trying to upgrade, right? Talk to your veterinarian and make sure that you've got all appropriate care and medications. So your Coggins, your vaccines, those types of things. You make sure the venue, you do it in plenty of time, and make sure that the venue doesn't require those things. And then talk to your equine wellness team, your massage therapist, your farrier, and then again, address the nutritional requirements. And so a possible checklist, and I like checklists, but a possible checklist is, obviously, I think I made my point about, the level of lameness in performance horses. So do get your veterinarian to do a soundness evaluation on your horse. Most of my competition horses for my clients, I do in spring and I do in fall. So we do the spring soundness check. We figure out what they're going to need for the upcoming season. And then in fall, we kind of have a look at them again, see how they've come through the season, make any changes we need to make. We might change the training over the winter, but do have your veterinarian, come and do a soundness check, because those subtle lamenesses, if we can catch them early, it's much better to do that than before they become a problem. Do take care of your horse's nutrition, and remember it's going to change throughout their age and stage of life. A 3-year-old is different than a 10-year-old, is different than a senior horse. Speak with a nutritionist. Check the fit of your saddle and check it regularly. Educate yourself so at least you know the basics. Talk to your farrier about, would he like your horse on a longer trim, longer trim schedule, shorter trim schedule? Would he like radiographs? Is he struggling to balance the horse? That's easy to do. Do pay attention to dental work. So, we saw that's important. Annual vaccines, cardins, and then again, the parasite control. I think it's really overlooked often, but maybe you're not doing right by your horse if your horse is, resistant, or the parasites that your horse has are resistant to one of the medications. So we do need to check that. And then other horse specific needs. So maybe if you have an older horse, maybe he does need some blood work to check if he's got Cushing's or if he's got any other things going on. And so those are just kind of, it's a real parachute bird's eye view of these are the things that we need to start thinking about to really help our horses perform the best. And hopefully that was helpful. Remember, we do this for fun. This is always my disclaimer. Remember, we do this for fun. Sometimes people get, pretty serious about this, and that's fine. But remember that we do this for fun, and we do it for the love of the horse. Usually now I'm going to get lots of questions, hopefully. So.
Thank you, Sarah. That was awesome.
Yeah.
I have not a question, but I just have, so the first thing you showed was Dr. Dyson's pain ethogram.
Yeah.
And there's actually, she's made, in conjunction with some other people, a YouTube video about it.
Oh, great. Okay.
Yeah, behaviors of the ridden horses.
Yeah.
And it's Googleable on YouTube, or look upable. Sorry.
Sure.
Yeah, when you're going through that, I was just thinking, I was like, I've seen that before, and I just quickly looked it up.
Yeah.
But it's definitely on there, and it's a whole documentary, and it runs through a girl and her horse, and it's very, very interesting, and lots of little things you wouldn't think of.
Correct.
So anybody interested in more of that, I can definitely, when I email everybody after the fact, and I can include anything you want to include, and I can also include the video link to that.
Great.
Erin Rousel has a question. She says, is there any other reputable nutrition brands that you like?
So yeah, there's a few actually. I really like, for horses that suffer kind of what we call fecal water syndrome, or they have that kind of cow patty, not great manure, and plus or minus, are they a little bit ulcery and they don't seem to do really well. There's a product out of the States that's called AssureGuard Gold. It's very expensive, I will say that, unfortunately, but it's really good, and I've had a lot of success for clients with that. And also, if you have your horse on that supplement, they actually cover up to $10,000 worth of colic surgery if your horse colics and it's on that supplement. So they kind of stand behind what they do. I've had a lot of success with that for those horses that are kind of irritable bowel syndrome, kind of fecal water, those types of things. The other supplements that are really good are the Platinum Performance supplements. And so again, they're out of the States, but it was a company that was set up by veterinarians, and they send all of their products out for external testing, and they guarantee that whatever is in there is what they say is in there. And there's a lot of actual independent research studies on those supplements as well. So those are two that I absolutely recommend and are reputable companies. There's lots out there that are really good. It's just, you have to do your homework. And the scary thing about supplements is Jessica and I could throw some talcum powder in a tin and we could put whatever we like on the label and say, we can say that it cures all the things, and
we
with
can.
zero accountability.
Yeah, and we can.
Right. And so it's just really a case of kind of buyer beware and do your research on the company. The big thing for me is, do they do independent testing to verify what's in, is what's in there what they say is in there? But those are the two that kind of I've had a lot of success with in my practice for clients.
Perfect. We have another question. Is it pretty common for horses to do eventing barefoot? And I will also say yes to this one.
Yeah. So if you look really carefully at this picture, that actually Jessica took this picture. This is me and my horse. He doesn't have front shoes on. He doesn't have any shoes on, actually. And I think at the lower levels, especially, I think it's pretty common. And I think it really, again, the whole barefoot shoeing thing is such a huge hot button topic. But I think it's horse dependent. My horse is fine without shoes on. But also I'm aware that, if the weather is really bad and the ground is really wet, I'm either going to change how I ride or I'm not going to run, because I don't have the option to put calks in, especially in the show jumping. So that's a personal decision for me. Other horses, it would be absolutely inappropriate. They've got thin soles and they need the support. So again, it's totally an individual horse-based decision. But would I say it's uncommon? No, I think it's pretty common that they go barefoot.
And I've been seeing in like upper level show jumping, a lot of
Yes.
barefoot horses are coming out of the woodworks now.
Yeah.
Like at the highest levels, like meter 60, which is very interesting. Yeah.
It's a very, very trendy topic right now. Like everything, the trends come and the trends go, but it's about, does it work for your horse? And also, is that appropriate? So like I say, the footing was really good here. It wasn't a problem. But if the footing was really slippery, I would either change my approach to the fence, I would change how I turn, or I just wouldn't run. And I'm okay with that. Whereas, if you're chasing, maybe you need, another run to upgrade. Maybe you're not comfortable to take that risk in the last show of the season, and you really want to get that upgrade in before the next year. You might choose to put shoes on so you can run in calks, because then you've got more flexibility with the weather. But yes, it is more common.
Perfect. All right. So next question. Will this recording be available if we want to watch it again? Yes, absolutely. We upload all of our talks and webinars to our AHTA YouTube. Obviously, you're here, you're registered. We are going to email everybody with anything else Sarah wants to send out, and the link to rewatch on the YouTube. What is the easiest way to check your horse for resistance against which kind of dewormer if they are heavy carriers?
Perfect. Easy question. Poop sample into your veterinarian. So what we do is we test the poop, and we do what's called a fecal egg count, and it's not very expensive, and it will show us what types of parasites are present, if there are any. And then we will tailor the deworming to that horse. But what we do is we deworm them, and then we rerun the test to see if there's been an appreciable drop. And if there hasn't, then that tells us that we've likely got resistance and we need to change our strategy. And your veterinarian should be able to help you with that. And that's not a specialist test. Like, most veterinarians should be very happy to do that.
Perfect. Katie asks, do you have an opinion on podium as a feed along with hay and alfalfa pellets?
Well, I always have opinions on everything. So my honest answer to that is, does it work for your horse? Have a look at the protein values, have a look at, some people say that alfalfa makes horses hot. So, and again, it really depends on your hay, and is your hay been tested? And then what's the protein level in your hay? And then what's the protein level in your podium? How much are you feeding? So again, I'm not trying to not answer your question, but it really depends on the hay analysis you've had done, your individual horse, and the individual horse's requirements.
Yeah, nutrition is such a
It's a
literally
tough
can of
one.
worms. Yeah.
And it's, I mean, the science behind it isn't so bad. Like the basic rules are not that. I mean, I'm old enough that the 10 golden rules of feeding from Pony Club, right? Feed little and often, and all of those, like, they still ring true today. But a lot of it is the struggle with nutrition comes because somebody's used something and their horse is doing really well, and somebody else is like, well, it didn't work for my horse, and they're both probably correct, because the horses are different, the feed is different, the grass is different, and so it really comes down to an individual basis. And often you look at an in-barn feeding program, and some of the best barns, they test their hay, they figure out what the protein level and what the energy level is in the hay, and then they try and they do tailor it to each individual horse. But nothing drives me crazier than when I say to a client, okay, what's your horse on? And the horse is on whatever, 12% sweet feed, sure, and then like 17 supplements, and it's like, okay, whoa, why are we giving all of this, right? And maybe there's a reason for it all, but the other thing that people don't think about is sometimes those will interact with each other and make them not bioavailable. And so I think there's a real trend in general in the equine industry to, I call it fairy dust. We like to put the fairy dust in. And it's not that it's wrong. And often horses do really well on supplements, but it has to be targeted, and you have to understand what you're doing and why.
100%. Definitely. Alan asks, if you have time, could you comment on outcomes for products like Equine in the study with injection 4 days? What was the difference between the placebo? Wow, words are hard.
I got it. I opened the chat. I'm good.
Perfect. Thank you.
So the statistical difference will have been 5%. So they use 5% usually as the cutoff. I don't have the paper off the top of my head, but I can certainly find the paper and send it out for you. So yes, there would have been a difference between a placebo injection, and yes, it would have been a statistically significant difference, which we usually use as 5% as like the rejection of the hypothesis. But I'm happy to send the paper out. I believe, and again, don't quote me on this, I'd rather pull the paper than try and guess, but I believe they looked at them 6 months out. So they saw a statistical difference 6 months out, as well as the time of administration. But again, I have a disclaimer on that because I don't have it right in the back of my mind here. And so I'm happy to actually pull the paper and actually answer the question.
We could put that in the email out to everybody too, if you'd like.
For sure.
Yeah. Christine asks, back to your wave mouth slide, is it curable or just manageable over time with dental care?
No, so it is curable, but the problem is when we do a dental flow, we can only take about 4 millimeters of enamel, and so what you have to do is the whole part of the wave, so where the tooth is worn down, there's nothing we can do about that. We have to wait for that tooth to grow in. But what we can do is shave down or file down the opposing tooth to allow that to happen. But we can only do that a small amount at a time. So it is curable, but it often takes a dental like every sort of 5-6 months over like the one that we saw that was a little extreme on the slide. That may take 3 or 4 years to fix with a dental every 6 months. But it's something, so that there's 2 questions to that. Number one, why did it form in the first place? Was it just because the order that the horse loses its baby caps and they grow in? Sometimes you'll get a wave mouth just from caps coming out and premolars coming in. Or is there actually some dysfunction in the temporomandibular joint? And even if we do our best to level it out, is it the way that the horse chews or wears its jaw, which is a different problem? So are we managing just a wave mouth that didn't maybe get dental attention in time? In which case, yes, we can cure that. It takes some time. Or is there a temporomandibular joint problem that we need to address to change the mechanics of the jaw? Does that make sense, Christine? Hopefully. Okay, has there been a comparison? Okay, good. Has there been a comparison between Adequan Legend versus Noltrex? So Noltrex is an intra-articular injection, and the studies that I'm chatting about tonight are the Adequan and Legend systemically, so either in the vein or in the joint. You can use Legend in the joints as well. There is a comparison between intra-articular hyaluronic acid, which is Legend, and Noltrex. So my understanding is that it really depends on the pathology that's in that specific joint. So if it's just a cartilage defect and you don't have bony change, my understanding is Noltrex is the preferred treatment of choice. However, the rate of reaction to Noltrex, they say it's inert, but I have seen reactions to it. Intra-articular Legend, we do know works, but my understanding is that it is better if there's actually bony change within that joint as opposed to just cartilage. I don't have the statistics, again, off the top of my head, but that's my understanding. Okay, for a competitive endurance horse with GI ulcer issues, what would be my favorite supplement or routine feed program? So if the horse currently has ulcers, we know that Gastrogard Gastrogard is the best treatment, usually plus or minus sucralfate. Endurance is a little bit tough because obviously feeding little and often during a race is sometimes not possible. But I think really that would be looking at potentially lots of alfalfa. There's a lot of calcium in alfalfa that can help buffer that. And then I really like, the supplement that I really like is the AssureGuard in those horses. There is a bit of a pH buffer in it that is very helpful with those types of horses. But like I say, unfortunately, it's not a cheap supplement. If you have a friend that is in the States and they can bring it up from the States for you, it's a lot cheaper. But you didn't hear that from me. Yeah, no problem. What else? Any other questions, or are we good?
I had a quick question.
Oh, hold on, one popped up. Sorry, Jessica. So what about bridles? What can I answer for you about bridles? Are you asking about the cutback bridles and the new kind of noseband relief and those types of things? Is that what you're asking, Heidi? Yeah, okay. So it's a real area of growing interest. What I can tell you is a poorly fitting cutaway bridle is never as good as an old-fashioned, well-fitting bridle. So the thought with those at the moment is that we've put, historically, the traditional bridles have put pressure on the facial nerve. And interestingly enough, I had a case last week, actually, where I have a vet student with me at the moment, and we were chatting about some things that could affect the temporomandibular joint. And I said, like there's a syndrome in people called trigeminal neuralgia, and the trigeminal nerve sits very, very close to the temporomandibular joint. And if the temporomandibular joint gets inflamed, often that trigeminal ganglia can get inflamed as well, and the horses just become very, very painful. And we think that it is a component, or at least one cause, of head shaking. And so I was chatting about this with my vet student, and I said, can you imagine if you're very, very painful and your head is painful and it's just all too much, the sensation of having that bridle on is just going to be too much. And she said, oh yeah, that makes sense. Then we went out to see this horse, and interestingly, the client said to me, yeah, this horse has done much better since I didn't ride it in a noseband. I've taken the noseband off. And I said, isn't that interesting? And so I'm really pleased to see the thought going into how can we make this better for our horses. Having said that, I do think there's a lot of merit in, when we used to use the horses as war horses or in battle and all of the rest of it, I think we did a fairly good job, with where the bridle goes. And again, for me, it's an awful lot more about the fit of that bridle. So a bridle that has a cutback on it, but the brow band is too small and is going to be pinching, I'd way rather have a traditional bridle that is correctly fitting. And so I actually really am pleased to see some thought into the horse's anatomy, the facial nerves, and those types of things. But I think they're quite tricky to fit well. And so I think if it fits your horse well, that's great. But I do think that it's more about the fit of the bridle than the kind of the new things that are coming in. So I really like it, and I think it's really good, but I think we have to get better at fitting those, because I've seen some that are not well fitting that are causing more problems than they're solving. Does that make sense? On the who I think it was Heidi, sorry, my chat moved on, but does that make sense, Heidi? Yeah, okay, perfect. And then Maddie asked, how often should a young horse that is starting to work get their teeth done, specifically when they're losing their caps? So that I recommend at least checking them every 6 months. They may not need to get them done every 6 months, but certainly check them every 6 months. Just because of the way those are coming in. And again, if they have a retained cap on one side and the other side's been lost, now we've got unevenness in the mouth. And so I recommend checking them at least every 6 months. It might not be that we have to float them every 6 months, but check them every 6 months. And Esther asks, the ulcers on the horse's tongue with the wave mouth, did they go away with treatment? Yes. So once we've taken the sharp points off the horse's teeth, they actually heal up very, very quickly. Mouths heal incredibly fast. And so once we've kind of smoothed that up and corrected it, then it clears up usually within a week or two, like very, very quickly. And then Jessica, sorry, you had a question.
No, it's all good. Actually, I have a different one now that there's all the talk about the bridles and the mouths. I have seen bit fitters pop up just recently. Like, what are your thoughts on that? Do you think that's like a thing people need to be looking into? Do you think that's a good idea?
So again, and so actually Esther just popped as well. I just watched a Bit Fitter webinar, and the presenter talked about subtle lamenesses when the bridle buckles were resting on the TMJ. And that's absolutely right. So the temporomandibular joint, through fascial connection, is connected. There's lots of studies showing hind end lamenesses that are related to TMJ issues. And so again, I think it's more about a well-fitting bridle. And if you can get one that doesn't put pressure points on there, that's great. But a well-fitting bridle is always going to be, whether it's a traditional one or not, is always going to be helpful. And then the bit fitters, again, I think we're just starting to learn and look at, does my horse have a fat tongue? Does it have a thin tongue? How is the roof of the mouth? Is the roof of the mouth, some horses' palate is very, very curved. Some horses' palates are very, very flat. Some horses do really well with a tongue pot. Some horses do really well with a different, a lozenge. And so I really like that we're trying to put a science to it and that we're trying to get the bit fitters. I do think also that as horsemen, we instinctively know a lot of it. And so, if you have a horse that likes to tuck behind the vertical, a lot of us have tried to, we've had success with, different types of bits or whatever. And so I think it's probably all linked to that. And I think as horsemen, we instinctively know a lot of that. If you're trying to raise a horse's head, sometimes we'll use a gag bit. And so I think it's coming from, I think we kind of know a lot of this stuff, and now we're trying to put the science behind it. Like, I think we were doing it, we just didn't know we were doing it. Mm-hmm. And you only have to walk into any tack room to see the large array of bits, right? And so I think instinctively we know that there's a huge individual preference in bits, right? Whether it's mouthpiece, whether it's this, whether it's that. And so I think it's like anything else. I think, a good bit fitter will be really great. It's just like a good saddle fitter will be really great. But I think it really depends on the person that's doing it, right? And it always it's always been a tough change for me, because I came from the UK with, a saddle fitter in every small town. Whereas we sometimes don't have access to that here, right? And so again, I think it's just about building your team. And do I think that bit fitters are helpful? Yeah, I think a good bit fitter would be really helpful. But it's like anything, there'll be good and bad ones that pop up. But I do think it's worth consideration. And I at least appreciate that we're trying to put a science to it now, and we're thinking about anatomy, and we're thinking about the horse's anatomy, and we're thinking about the nerves, right? Again, behavioral changes are pain until proven otherwise. And so if that bridle is causing pain on the TMJ, well, we better take a look at it.
Perfect. Thank you. Yeah, like the bit fitting is definitely a very new thing, but I've been hearing a lot about it lately, so it's great to hear your input.
The posh word is Lornery science. That's and they're doing a good job. But again, it's like anything. I think you have to be careful, because of course they're promoting, a lot of them promote their brand of bit, which is, maybe great, maybe not. Mm-hmm. But it's like anything, as long as you trust the person doing it, right? Same as saddle fit.
For sure. And it's all a progression with the technology and everything too, and the education.
Right. Any more questions? Just in case anybody's thinking anything. But, I think for me as well, like I said, remember, we do this for fun, but we do this for the love of the horse. Mm-hmm. So anytime that we're doing something that is better for our horses, it's always a good choice. Whether that's, we're getting better with saddle fit, we're getting better at understanding deworming protocols, we're getting better at understanding dental care. Like, anytime that you can try and do better, I think is a good thing.
Mm-hmm. 100%. The horse always comes first.
Okay, are Micklem bridles supposed to lower the jaw or used to keep the horse's mouth more closed? So my understanding with the Micklem is that it essentially works like a flash noseband. So there's a high part and a low part. So yes, they're supposed to keep the jaw closed, but they're supposed to be pressure relief. But again, it also depends on what bit you use with that.
Any other questions? Let's see, while we're waiting for anything else to pop in, I will thank Sarah again for doing this amazing talk for us. and thank the HTA as well as Kathleen and Alberta High Performance. We're great. We're so happy that we had such a great turnout, and we appreciate all of you coming in and listening and asking questions.
Absolutely.
Jen says to remember the 2-finger rule for nosebands. Yes, definitely.
And I don't know if they'll have the little gadgets, the pressure gadgets this year, but they're coming out as well.
Yeah, they have had at a few events.
Yeah.
Yeah.
And the other thing I will say is if there's something that I didn't cover that you're like, hey, like you really missed this and we'd like to know about it, let me know. I'll let Jessica know and she'll let me know.
And we can do another one of these. We can answer all of your questions. Awesome. Thank you everybody for coming out, and thank you for all your wonderful thank yous.
Thanks everybody. I appreciate it. Sometimes, like I say, this one I struggled with a little bit because initially I was going to talk about kind of, you know, subtle lamenesses, and then I was like, oh, that's so much more than this.
It's such a broad, like it's, yeah, like such a broad topic.
Yeah.
So I think it's great. You touched on a lot of little things. You got people really like thinking and wondering about things, and hopefully that will all carry forward to being better with our horses.
Yeah, that's the goal.
Yeah, definitely. All right, so it doesn't look like anybody else has any questions. So I guess we'll sign off here. Thank you, Sarah. Thank you, HTA. Thank you to Kathleen and High Performance. And thank you all of you wonderful people for joining us.
Thanks.
Yeah, we will see you again.
See everyone out there. Get your horses fit.
Yeah, see you this summer, hopefully. Bye.